Most people over 50 walk every day with good intentions, but very few realize that the way they walk can either multiply the health benefits or quietly work against them. Several simple habits, often done without any awareness, can reduce the positive effects of walking and even create new problems for joints, posture, and circulation over time. Understanding these habits and making small corrections can completely change what walking does for the body. After the age of 50, the body goes through a series of natural changes that gradually affect everyday life. Muscle mass begins to decline at a faster rate, joints become stiffer and less flexible, metabolism slows down, and blood circulation becomes less efficient than it once was. These are not signs of illness. They are simply part of the natural aging process. However, the good news is that regular physical activity can slow down many of these changes significantly. Among all the forms of exercise available, walking stands out as one of the most practical, accessible, and effective options for older adults. Walking works on multiple systems in the body at the same time. When a person walks regularly, the heart becomes more efficient at pumping blood throughout the body. Muscles stay active and maintain their strength over time. Joints continue moving through their natural range of motion, which helps prevent stiffness from setting in. Blood flow to the brain increases, which supports memory, concentration, and mental clarity. Studies conducted over many years have consistently linked regular walking to a lower risk of heart disease, type 2 diabetes, and cognitive decline. However, all of these benefits depend heavily on how walking is actually done. Small mistakes made every day can quietly reduce its effectiveness or even introduce new physical problems that were never there before. One of the most frequent mistakes people make is starting a walk at full speed. It feels natural to step outside and immediately begin moving at a brisk pace, especially when time feels limited. But jumping straight into fast walking puts sudden and unnecessary stress on muscles and joints that have not yet had time to prepare for movement. In the morning especially, muscles are still tight from hours of rest, and joints have not yet been lubricated by natural movement. When the body is pushed too hard too quickly, the risk of muscle strains, joint discomfort, and early fatigue increases. A much smarter approach is to spend the first 3 to 5 minutes walking at a relaxed, comfortable pace. This gives the muscles time to loosen up, allows the joints to warm up naturally, and lets the cardiovascular system adjust smoothly before any increase in effort. This simple habit of warming up properly can make a significant difference in how the body feels both during and after a walk. Posture is another area where many people unknowingly make things harder for themselves. Slouched shoulders, a head that leans forward, and eyes pointed down at the ground are all very common sights among walkers of every age. This posture may feel comfortable in the moment, but it creates real problems over time. When the head moves forward out of its natural position, the muscles in the neck and upper back are forced to work much harder to support its weight. This leads to chronic tension, soreness, and sometimes pain that can become persistent. Poor posture also compresses the chest, which limits how deeply and freely the lungs can breathe during a walk. When the lungs cannot fully expand, the body receives less oxygen with every breath. Less oxygen means less energy, less endurance, and a less effective workout overall. The correction is straightforward. Keeping the head upright as if a gentle string were pulling it toward the sky, relaxing the shoulders and allowing them to sit slightly back, and directing the gaze forward rather than downward allows the body to breathe fully and move with much greater ease and efficiency. Footwear is something many walkers overlook entirely, yet it plays a much bigger role in long-term joint health than most people realize. After years of daily wear, shoes lose the cushioning and structural support they once provided. Many people continue wearing old shoes simply out of habit, while others choose footwear based entirely on appearance without considering whether it actually supports the foot properly. With every step taken in poorly supportive shoes, excess pressure is transferred directly to the knees, hips, and lower back. Over months and years, this repeated stress can contribute to pain and inflammation in these areas. A good walking shoe should do 3 things well. It should have adequate cushioning to absorb the impact of each step, proper arch support to keep the foot properly aligned, and a flexible sole that allows the foot to move through its natural motion. Checking the condition of walking shoes regularly and replacing them when they wear out is a simple investment that protects the joints with every single walk. Another pattern that limits the benefits of walking is doing it too infrequently. Many people take one long walk on the weekend and feel that this is sufficient for their health. While any walking is better than none, the body responds best to consistent and repeated movement rather than occasional large efforts. Regular walking sends a clear and ongoing signal to the muscles, heart, and metabolism that physical activity is a normal and expected part of daily life. When that signal is only sent once or twice a week, the body never fully adapts, and the long-term benefits remain limited. Research suggests that walking for 20 to 30 minutes most days of the week produces far greater health improvements than walking for a longer time much less frequently. Building walking into a daily routine, even on busy days, creates the kind of consistency that leads to lasting and meaningful health changes over time. Arm movement is something many people never think about at all. It is common to see walkers with their arms hanging motionless at their sides, as if they are simply being carried along rather than actively moving. But the natural swing of the arms during walking serves several important purposes. It helps balance the movement of the legs, creates a natural rhythm that makes the whole body work more smoothly, and engages the muscles of the upper body in the activity. When more muscles are involved in any physical activity, circulation improves, more energy is used, and the overall benefit increases. There is no need for exaggerated or forced arm movements. Simply allowing the arms to swing naturally, bending the elbows slightly, and letting them move in a comfortable rhythm alongside the legs is enough to make a noticeable difference in how walking feels and how effective it is. Phone use while walking has become one of the newer problems that affects a growing number of people. Looking down at a screen while walking combines two of the most harmful walking habits into one. It pulls the head forward and rounds the shoulders, recreating all the posture problems discussed earlier. At the same time, it takes attention away from the environment, increasing the likelihood of stumbling, losing balance, or not noticing uneven ground. Walking is an opportunity for the body and mind to be present in the same moment. Breathing, movement, surroundings, and physical sensation all come together in a way that supports not just physical health, but mental well-being too. Putting the phone away during a walk, even for just 20 or 30 minutes, makes the experience significantly safer and far more valuable. The final and perhaps most overlooked aspect of a healthy walking habit is recovery. Because walking feels gentle compared to more intense forms of exercise, most people assume the body needs nothing afterward. But even low-impact activity places demands on muscles, joints, and connective tissue that benefit from proper care. Drinking enough water before and after a walk keeps muscles functioning well and supports circulation. Taking a few minutes to stretch gently after walking helps maintain flexibility and reduces the stiffness that can build up over time. Occasionally allowing the body a day of rest gives it the opportunity to recover fully and adapt to the regular demands being placed on it. Treating walking as part of a complete health routine, rather than just an isolated activity, leads to much better long-term results. Walking remains one of the most powerful and accessible health habits available to anyone, regardless of age or fitness level. It requires no equipment, no membership, and no special training. It can be done almost anywhere at almost any time, but like any tool, it works best when used correctly. Paying attention to how a walk begins, how the body is positioned throughout, what shoes are worn, how often walking happens, how the arms move, where the attention is directed, and how the body is cared for afterward transforms an ordinary daily habit into something genuinely powerful. These are not complicated changes. They are small, practical adjustments that anyone can begin making immediately. Over weeks and months, these adjustments add up to a walking habit that truly supports long-term health, strength, and vitality in a way that few other activities can match.